So now we're going to do the friction therapy for the deltoid ligaments. Remember, there are 4 of them, and sometimes they're all injured, sometimes just 1 or 2 are injured. So you've got to be able to find them and work with them appropriately. First, let's try to find the first one. Okay, here we go. So this is the tibio-navicular ligament, and it's right here in the front. You see, this is the medial malleolus, and the ligaments go all around this base here. And if you flex your foot for a minute, here's that tendon here, the tibialis anterior. Relax now. It's right on the medial side. You can also push it the other way. It's usually you want to get on the medial side of it. And you're going to be pressing against the medial malleolus. So you find the ligament there. This is where it's going to be tender, and you're going to come down. You push down against the edge of it because it's going this way. So my friction is going to go that way. So I'm frictioning, relax, frictioning, relax, frictioning, relax. Always taking the skin with me, applying pressure against the bone. Okay? And then I would do that for 5 minutes. And let's say the other one is injured as well. So let's find that one. The anterior tibio-talar ligament goes down here to the talus right here. Okay? So when I move over a little bit, just a little bit, right next to it, and I go friction, relax, friction, relax, friction, relax, friction, relax. Keep doing that. See how I'm taking the skin with me. I don't go over the skin and irritate the skin. That's a good way to lose a client. Make them bleed. Okay, they don't like that. Alright, so that's the second ligament, the anterior tibio-talar ligament. Now you come to the one that goes straight down here, and that one is the tibio-calcaneal ligament, the tibio-calcaneal ligament. So here, go slightly back to the calcaneus right there, and I'm right under the medial malleolus, and I'm frictioning this way, relax that way. I can also use my other hand and come here, relax, here, relax, here, relax. And be sure you switch so that you don't get tired. And the final one is going backwards this way. Okay? And the final one is the posterior tibio-talar ligament. The posterior tibio-talar ligament right back here. So I come right there, right along the medial malleolus. And I'm frictioning it in this direction. I can do it in the other direction. It doesn't matter. Just one direction at a time so the person can handle it. And you can do it for a long time. The point is you need to do it for a long time. 5 to 10 minutes in each section. It's a little boring. You could sing to the person. Sometimes I do that. Or tell jokes or have a conversation. Or just meditate on the ligament. All right, so now we can go a little bit further down. Now that was just at the tip of the medial malleolus here, right at the attachment. So it could be further down here. Could be further down here, could be further down here for all of these different ligaments, also even further. So you have to find out through your palpation. Your test will tell you what's injured, then through your palpation you'll see where it is. But in 90% of the cases it's going to be right at the attachment here, right at the attachment here, right at the attachment here, and finally right at the attachment here. So this one is the tibio-navicular ligament, this one is the anterior tibio-talar ligament. This one is the tibio-calcaneal ligament, and the back one is the posterior tibio-talar ligament. Okay, so go friction away.